Hello, very good morning to all of you. Today we are going to see the case now of Maria Joseph, a 10-year-old female client of yours who is being referred to the resident doctor in an emergency department for further management and treatment. So this is the client and she was suspected to have nephrotic syndrome. Now, the investigations confirmed that she has minimal change disease. That's a biopsy confirmed, and she was treated with some steroids and some other medications, and then she was immediately be transferred to the a resident doctor in the emergency department for a because this you are working in a clinic and this is you have to give specialized care to Maria Joseph. So you need to refer her to a hospital with an advanced setting. So that's the reason that we are writing to the emergency doctor. And this is the condition. And this is a 10-year-old girl. You can see from the date of birth. You can see some relevant things in the first part. That's the asthma. We can say asthma and eczema, and she was taking some medications. Other than that, we have the name, date of birth, and that's it. Now we don't have to go ahead with these things. We don't go with the history of fall and or refall. These things we don't need all these things here because we are dealing with a different condition. Now we have the chief complaint here, and it was 2 days ago when she was presented to us with a swollen face and progressing to abdominal extremities and non-pitting edema. So we have suspected the things. So we have suspected nephrotic syndrome, and we have gone for the investigations, including albumin, creatinine levels, urinalysis, total count, kidney biopsy, and ESR. So we have to see what happens there. And this happened on 10th, and after 2 days today, the results came, and you can see because this condition is preliminary dealing with the proteinuria. You have to go ahead with the urea and albumin level in both blood and urine, actually, and then you can go with a biopsy. That's what we have done here. Now, what we have seen, the results are mostly abnormal. You can see the presence of albumin in the urine. You can see protein loss and the urine too. Now you have confirmed the diagnosis with the biopsy. The biopsy confirmed that she has minimal change disease, and that's what this thing is. And now the treatment, we started the treatment with prednisone and furosemide. What we have done here, and after that, what we have to do is that we refer to referred Maria Joseph to the emergency department, the resident doctor. So today's date is 12th May 2020. I'm writing to the resident doctor, emergency department, Wake Forest Hospitals, and Fort Worth, Texas. Dear doctor, so let's go with Maria Joseph, 5th November 2010. You can see all these things once again, slowly. Maria Joseph. Yes, history, chief complaint, examination. Pathology results and diagnosis and treatment. That's what we have to concentrate on in your letter. Okay, now I'm writing the letter. Thank you for accepting Mariana Joseph I think the spelling is, yeah, Mariana Joseph. Thank you for accepting Mariana Joseph, a 10-year-old girl with minimal change disease. She requires an urgent medical assessment and management at your facility. So you have written to the emergency department doctor. So that's why we started the letter like this, because you transfer the patient to the hospital via an ambulance. So when you receive the patient, the letter will be there for the doctor to read. So as you receive the patient, the doctor reads the letter. Thank you for accepting Mariana Joseph, a 10-year-old girl with minimal change disease. So this is, the age is not relevant in most of the letters, but why I have given the age here, a 10-year-old girl, because this is a condition which affects, this is a condition which affects uh, the children, and that's what we have to, that's what we have mentioned, the the age there. She requires an urgent medical assessment and management at your facility. So we have said urgent medical assessment and management. Now, what we have to do here is that we need to move further and explain her condition, what happened. So we need to sort out which are the relevant data which an emergency doctor requires from this case note. So this is, there is a problem here. So where do we start? Can we start from 10 or can we start from 12? So we have two dates here with the recent complaint. It's 10/5/20. That's the day she came with the compliance of this thing. And we have got the results on 12. That is a very recent date. That is today. So you are writing to an emergency doctor. So where do we start? So this is a common confusion. So many people, they start from this point. So some try to start from this point. So they are confused. So how do we start from this point? So there is a solution here, and the solution is here. Mariana, one of our regular clients, was suspected of nephrotic syndrome on her recent visit, and hence a series of investigations were performed on her. Okay, so I have to say, um, and specific investigations were performed on her. So it's not a series of investigations. We have specific investigations. Why I will use the word specific in the sense we have suspected nephrotic syndrome. So we are not going to go ahead with a random blood things. We need to go ahead with some investigations which are relevant to the condition. That's why I use the word specific investigations. Today, her pathology results came, which revealed the following. So we have the pathology results came today. So we are going to see today's case. Now, but before that, the first sentence, we have to give a background information. So how the results came. So we cannot start directly her pathology results short like that. So that's the way we have used. You have used the first sentence like that. So in this first sentence, I have said that we said that she's one of our clients, and the reason why we ordered the investigations is because we suspected nephrotic syndrome when on her recent visit. It's not explained there, and hence specific investigations were performed on her. Today, her pathological results came. Now we have the rest of the paragraph with full of these reports. So we are going to showcase the results to the doctor, the emergency doctor. This is the most important thing here, which a doctor needs. So we need to see the blood urea, protein, albumin, all these things which are on an ESR. So I cannot say simply that certain investigations were done and that's abnormal. I have to say what are the problems. So this is a condition. You need to assess, okay, this is the problem. So this is the intensity of the condition. So that's why I'm referring the patient to you. So all the investigations, all the relevant investigations are highlighted there. And the last sentence, biopsy confirmed the diagnosis and therefore she's been transferred to you on an emergency basis. So the reason why she is transferred to you on emergency basis is because she has been diagnosed with the disease. The biopsy confirmed, and this is the condition assessing this is a medical emergency. That's why we have transferred to you. We could not handle her anymore in my clinic. So that's why we did that. Mariana's most recent visit was on 10th of this month. And it was when she was observed to have the suggestive symptoms of the aforementioned condition. So this is the thing here. It's not that much relevant, but we have to say the history that this was on 10th that she presented. In the previous paragraph we have said on her recent visit. So this sentence is not actually that much significant, but it's given just for a continuity of this thing. So her most recent visit was on 10th, and it was then she was observed to have the suggestive symptoms of the aforementioned condition. So we have not said swollen legs, swollen face, all these things, non-pitting edema. The doctor knows that the suggestive symptoms of the condition, doctor knows. She has a history, but now something relevant comes regarding her past medical history. She has a history of asthma and eczema, which were treated with regular medications. Now, which were treated with regular medications. Now, we don't have something which, yeah, we have to look at where it is. Yes. In your condition, you can see asthma at the age of 8, eczema till age 19. So we have 2 medications too. So I don't know whether she's taking the medications at present or whether she has the problem at present. So that's why we use simple past tense here, or else we would have used she has been taking. So that's the thing here. It would be appreciated if you could attend her on an emergency basis. We have to say that attend her to evaluate her condition. Attend her because we have used emergency basis another time. Attend her to evaluate her condition and provide her the best possible treatment which you feel the most appropriate at the earliest. Okay, so I have written at the earliest because we have used urgent ones, we have used the emergency basis another time. So it will be a repetition. So I just avoided the situation here. It would be appreciated if you could attend her to evaluate her condition and provide her the best possible treatment, which you feel the most appropriate at the earliest. Of note, she's currently on prednisone and furosemide 20 mg. So that's something which is relevant here. We have ordered some medicines for her for the current situation, and that's something, the dosage and the name is needed. It's very relevant, and that's what we have highlighted at last. If you require any further information, please do not hesitate to contact me. If you require any further information on Mariana, please do not hesitate to contact me. So yours faithfully, nurse. Okay, so it's a nurse practitioner, I think so. Because if you want to treat, so it would be a nurse practitioner. So thank you. And that is the end of the explanation. Right? Have a nice day. Thank you.